the metacarpal. Alright, as we can see on this imaging, or on this image, this picture shown, which is the image evaluation of the radiograph, that shows what? Over rotation of the hand. That is, the hand on this image has been what? Rotated too much. So, one, and this can what? It can obstruct or obscure the visibility of certain anatomical features, as I've said earlier in the previous recording. And one, we need to know that the patient's demographics, that is talking about the patient's name, the age, and all other information about the patient, they have been removed for confidentiality. So the patient demographics have been what? Removed for, it has been kept what? Private, as one of the duties of a legal and ethical profession or professional. So, two, the area of interest is what is included. That is the metacarpal. We have the what? The area of interest included. Talking about the what? The metacarpal, they are all included. So the metacarpals are what? They are included. We also have what? We also have the phalanges. Possibly the what? The phalanges are also what? The area of interest. They are also what? They are all included. The phalanges are what? They are the bones of the finger. They are also what? Included. They are included. So we also have that. Another one is correct anatomical marker. So it's the what? The correct anatomical what? Correct anatomical marker. And the correct anatomical marker, as we can see on this radiograph, is what? It is right. Permit me to use this. I believe we can see the correct anatomical marker. So the correct anatomical marker shown on the radiograph, on this image, is what? Is right. It is what? The correct anatomical marker is what? Is right. That is, the anatomy depicted in the image is what? Is accurately oriented with a marker, indicating that this image shown is of the right hand. So this is a radiograph of the what? Of the right hand. So another thing is that, which is our number 4 point to note, is that the hand is over-rotated, and over-rotated with what? With third, fourth, and fifth metacarpals superimposed. So hand rotated with the third, the fourth, and the fifth metacarpals superimposed. That is the positioning of the what? Of the positioning of the third, fourth, and fifth metacarpals of the what? Of the hand has resulted in the third, fourth, and fifth metacarpal bones overlapping in the image. So the third, fourth, and fifth metacarpal, as you can see on the image, they are what? They are overlapping in the image, which can make it difficult to access them individually. So such superimposition, it can obstruct potential fractures or pathologies in the bone. So let's say the radiologist will not be able to assess the third, the fourth, and the fifth what? Metacarpal. Not be able to assess the third, the fourth, and the what? And the fifth metacarpal. So another thing to note here is that, which is our number 5 point concerning the evaluation of this radiograph, is that correct image exposure, that's image exposure index, that's EI, correct, and there is no noise. So this radiograph shows a correct image, or has a correct image exposure. That is, the exposure index EI is correct and there is no noise. The exposure index here is what is appropriate. That is the right amount of what the image has been captured with the right amount of radiation. I think exposure index is the same as exposure indicator, as I've said earlier. So on this radiograph shown now, the exposure index, that's EI, is correct and is appropriate. That is the image has been captured with the right amount of radiation, and there is no noise present in the image, meaning that this image is high and clear. The image is high and clear. There is no noise. Also, we have that another point is number 6, optimum resolution. Optimum what? Resolution. So good boning, trabecular and soft tissue what? Resolution. So that is, the image technique has resulted in high resolution detail. The image technique has resulted in what? In high resolution detail, allowing for clear visibility of both the fine bone what? Structures, which is the trabecular pattern. So this image help us, or with the clarity of the trabecular pattern, TRA. Okay, as you can see, just go to your class and get that. So it's help us with the clarity of both the fine bone structures on the radiograph, which is the trabecular pattern, and the soft surrounding tissue. So this image, it has an optimum resolution. That is, the trabecular pattern, which is fine bone structures, they are clearly seen, as well as the soft tissues are also clearly seen. That's resolution, optimum or maximum resolution. So another thing is that this image has been collimated to the area of interest. That's number 7 point. So collimated to